Hey guys. Not yet.
So you see it right there?
Oh, there it is.
And then just show you. We'll add us to the screen on it. Okay.
Yeah. Okay, perfect.
Hey guys.
So we're live on Instagram and now we're live on Facebook.
Live on Facebook too?
Thank you.
How's everyone doing today?
I'm getting live.
Second more fat. Another day in MyShapelipo. Changing lives.
Yes, I'm doing it.
So you can see we got a larger abdomen here that I think you guys have seen in the past. So this is we consider this more large volume liposuction. But this is something that I think that there's lots of people out there that need this, that think that they might be too big for liposuction. So this is, I thought, would be a good demonstration for you to see this, see how big of a change we make. And you're going to literally see this whole abdomen get smaller as we're working here. So it'll be pretty cool.
Someone said, how are your weight doing? I'm weight, girl. You're awake.
So we're able to have our patients awake by using numbing medication. So we numb only the area that we're treating.
Thank you.
She said she raised her credit score.
Yes, I'm awake. You guys, does it hurt? You can, not really. Minimal. It's not bad at all. Because I'm numb. Thank you. There's nothing to terrify about, Kathy.
I love this. So we have her and then it's both.
Yeah, that's pretty cool.
Someone said I was passed out.
So if you guys have any questions or concerns as we're going along here, or you see something, I do something, you're like, what did you just do? I'm happy to explain and share everything with you, so just ask the questions. Hopefully the girls will read them off to me.
So how many areas of liposuction are you doing?
Use one would ask that. So, you know, our pricing is based off of areas, and we charge typically $12.99 per area, and the area is about the size of your hand, more or less. So typically on an individual, you'd have the upper, lower, and the pants, but as you see, the area that the surface area that we're covering here is much larger than that. So it's more like 1 area, 2 area, 3 area, 4 area, 5 area, 6 area. And you can see we're going all the way down to the sides over here and taking care of the entire front of the abdomen. So on this individual, she had the problem with the belly hanging down in the front, and she was larger and wider, so we wanted to cover everything in the front of the abdomen. It doesn't fit in exactly into our areas, which we've described them in the past, so we change the way we do it, we adjust.
Someone asked, what is the healing time?
So the healing time is going to be different for everybody, but typically, you know, the process is such that after the procedure, you're going to get swelling, you're going to get soreness, you're going to get some bruising, and that stuff will stick around for anywhere from weeks to potentially months. Typically, the soreness and stuff and everything is kind of front-loaded, so you'll get that more in the first couple weeks, and then it'll continue to get better after that. But everyone's different, so you can't just hear that one person did it one way and then expect that that's exactly the way it's going to be for you. In fact, that's the way it is in life. It's never exactly the same, so you know, take this up with a grain of salt. It might be better for you, it might be worse for you, we just don't know. But this fat's flying out. We got over 1 liter of fat out already. We're doing great.
Someone asked if I get a consultation now and wait for a few months, or I have to do another.
No. The consultations are just for your information. We have people that fly in here and, we make final decisions on the day of the procedure. Because especially if you're flying in from out of state and sending in pictures, like, you can see a lot through pictures, but you can't see everything. And you can't appreciate everything. So when we get to here in person doing a formal consultation and see exactly what we have to deal with, we may have to make some changes and adjustments.
Can you be asleep during the procedure?
Yes, you can. But when you say asleep, general anesthesia is typically what people think of as sleep, and that's not what we do. So can you have general anesthesia? Not with me. You can with other people. So if you want to do liposuction with general anesthesia, go to the, first of all, general anesthesia is an old way of doing this, and the only people that do it the old way are plastic surgeons. Okay? So let me repeat that so you guys didn't hear. The only people that do this the old way, the unsafe way, the more costly, more expensive way, the only ones who do that are plastic surgeons now. So be careful who you listen to.
Does it hurt? No, guys, because I'm numb. Now you feel a little pressure. No, if I was hurting, I would be on this phone. Thank you. How long does the procedure take?
With everybody, it's different how long it takes. Today, I don't know how long it takes. I just keep working till I'm done. But sometimes the procedures are very difficult and complicated, and other times they're easy and everything goes really smooth. The fat comes out easy, and other times it just doesn't come out easy, and it's really challenging and difficult. So I can never predict exactly how long it's going to be. Nor does that really matter to me. I just do my job, and my goal is to get out as much fat as I can for you and make it smooth and easy and look natural. So if that takes me longer, or that's been longer, and if I'm done faster, we can go faster.
How much if I weigh 230 pounds, will I be able to do the lipo? Girl, I weigh more than 220 pounds. What are you talking about?
And we get that question a lot. People are asking, like, is there a
I weigh more than 220 pounds, so yes, I can answer that.
That's exactly why we wanted to show this, is because there's lots of people that have that same question.
And here's how much you've taken out so far.
Yeah, that's my fat.
Here you go for the two. The fat train. The gravy train right there.
This is dope.
If you're coming out of state after the procedure, can you hop back on the plane? I live in Texas. I'm in Vegas. Yes, you can transfer fat. That's not what I'm doing, but you can.
So we're getting smaller. I can feel that it's the thickness, the fullness that I'm pinching here is getting smaller as I'm working here. Take a little bit longer for me to get generalized reduction in size here. You start seeing more bigger change in the shape of everything.
How much you have to weigh to get
Kind of
lipo?
working around here. You say ask how much you have to weigh? There is no weight limit. As long as you got fat. The only requirement that I have.
It's weird.
I don't feel, all I feel is like a vibration, you guys. I'm numb. Someone said, why is she so fine?
I don't know the answer. But I do agree. You're right.
Yes, come check him out. I lost the comment.
You lost it. Which one?
Painful Diabetes. Yes, come see Trevor.
Hey, can we pin something?
Yeah.
Like the website or...
Do you want to pin it in mine?
Yeah, MyShapelipo.
Yeah, well, if you make a post, then she can pin it.
Okay.
No, it doesn't hurt you guys. I'm numb. Ellabelle_84. Yes, you should definitely get it done.
Okay, there it is. Okay, you can probably pin that one.
I am MyShapelipo in Vegas. Yes, Jack 11. Thank you. Yes, he's in Vegas. You're welcome.
Man, this is just lying out. We got almost 2.5 liters out of here already.
Sweet baby underscore. I just pinned his information, sweetie. Yes.
What you said, this is awesome.
So if your belly bothers you, maybe it's the way it looks, but more importantly, maybe it's limiting you on your motion, your mobility. Maybe you can't bend forward. Maybe you have problems breathing because all this heavy weight that's pushing on your diaphragm. You know, I was talking earlier about, you know, laying on your back and having a 30, 40 pound weight on your stomach. That's essentially what having this belly is. So there's side effects to that. There's problems, there's complications, there's limitations that it has on your life. Many of you probably rationalize in your mind, say, oh, that's just the way it is, and you survive because that's what you have to do. But the reality is that you don't have to live that way. We can get the stuff out in one afternoon, and it's not that hard. You see how quick and easy the stuff's coming out, and tell she's live during the procedure, answering questions.
Someone said, do you thighs?
We do what?
Thighs.
Absolutely. I suck fat. Where do people have fat on their bodies? Everywhere.
How much time can you take off?
Can you take off, or do you
Yeah.
need to take off?
Yeah, do you need to take off?
Okay, so you need to take off. Everyone's different. Some people get this done and go back to work the same day. It's possible. It doesn't mean you should. Everyone's different, so you have to kind of pick and choose. There's some people that are up right after the procedure doing stuff. There's other people that might be laid up and want to stay in bed for a couple days. It's totally up to you. I would encourage you to get up and walk around fairly quickly. You know, what kind of work you do is going to be dependent on how quickly you get back to work. If you're doing more physical labor, it obviously may take longer. If you work at a desk, sedentary type job, then you can probably get back to that a lot quicker.
No, they don't put you to sleep, girl. Someone said, I know his arm's tired.
That's Superman, baby,
Yep.
Superman.
Oh my goodness.
Girl, they want to know where your husband is.
Afterwards, I'll be showing you my biceps.
Hey.
Everything is going good, you guys. No, I'm not in any pain. My kids are at home with my mom. And yes, my husband is here. He's in the, what room is that? He's in the waiting room, you guys. Of course my husband's here.
You watching live, you think?
No, I don't have no social media.
What?
No, he's not about that social media life.
What eyeshadow are you wearing? Somebody said, what eyeshadow are you wearing?
I don't know, something for car, I'm not sure.
Swimming.
Yes, I'm okay. Does the $12.99 per rate fee include anesthesia?
Yeah.
Yes.
But so when you say anesthesia, it's local anesthesia, which is why you're able to be awake.
You heard him, guys?
General anesthesia is much more expensive, and it's also much more dangerous. So a lot of people have problems with general anesthesia. In fact, most of the complications of any surgery, let alone liposuction, but any surgery, the biggest complications come from the general anesthesia.
They want to know, will there be loose skin after for larger women getting this done?
So again, everybody's different. And it's not about being a larger woman, whether your skin retracts back. It's about how well your skin is, if it's loose and stretched out beforehand, then you're going to have loose, stretched out skin afterwards. But you got to keep in mind that a lot of people, larger individuals, will have, when they're bigger, their skin's nice and tight because it's filled. And I use the analogy of a water balloon, in that when it's filled up, you have the skin looks nice and tight. Now, when you reduce the volume, there's going to be possibly some extra skin. But I can't stress enough how well the skin tightens up after this procedure. It's amazing, and there's no way that I can predict it exactly, but all I can tell you is that most people don't need tummy tucks. And that's something that you're not going to hear, you're certainly not going to hear from plastic surgeons. Plastic surgeons are telling girls that are like 105 pounds that they need tummy tucks, so it's complete nonsense. But you'll see through some of my pictures, some of our large individuals that have their belly hanging over, that you might think that they're going to have loose hanging skin. It just doesn't necessarily happen that way. So I would suggest, and I do suggest, get your liposuction first, get the fat sucked out, and if you do have loose skin, you can always cut that away. It's really easy when it's just the skin. It's a problem when you're a larger individual and you have a lot of fat and loose skin. When they do the tummy tuck, they just simply don't do enough liposuction to get the fat off. So now you have a huge scar, and then you still need liposuction. So come get the liposuction first, and you may not need a tummy tuck. And if you do, then there's no harm. You go get your tummy tuck, you do your thing, it's a lot easier. But you got all the fat out of you, and it's gone permanently.
Someone asked, will she need drains afterwards?
No drains.
No drains.
That's a tummy tuck thing.
That's for tummy tucks, boo, not for this.
And you're up walking around right after the procedure. You can go out to lunch right after the procedure. Since you're not asleep to general anesthesia, you're going to feel good after the procedure.
He said, how are you not touching any organs?
Well, that's skill. That's why you don't do this at home.
Somebody answered, he's a professional.
It's technique. It's all technique.
Would you recommend this for someone that doesn't have children yet, or wait until after baby?
So I got a good story for that. My sister had liposuction a while back. It was probably 10 years ago. And she had 2 kids after she had her liposuction. And she said that everything went back to the way it was as soon as she got back to her normal weight. So as far as waiting, you don't have to wait. It's totally up to you. You don't have to wait until you have kids. That certainly doesn't make any difference.
What does the squeezing do?
The squeezing? Okay. So you guys asked me about my technique and how I don't hit the internal organs, so I was going to explain it to you. So when I squeeze, so imagine I squeeze with my fat here, my fingertips are touching the muscles. My fingertips are touching the muscle, and when I go through the middle here, I know where the muscle is. And I stay with the proper plane, so I'm parallel to the muscle, which means I'm never going to dive down and hit the muscle, which means I'll never hit the organs. So it's simple technique.
He said he's skilled, don't die. Does wearing a waistband help keep the stomach tight after lipo?
Okay, so we use compression garments. You can call it a waistband, waist trainer, whatever you wear that gives compression. Some people wear Spanx. That's fine. The more compression you have after liposuction will reduce the amount of swelling. So we got over 3 liters of fat out of you.
Y'all hear that? 3 liters of fat. You gotta see the fat.
You know, someone actually tried to tell me once, they're like, why do pensions? Like, other doctors don't do that. You shouldn't do that. I'm like, man, when you do 20,000 of these, you can tell me what to do.
Exactly.
Otherwise, watch and learn. When you do this enough, it's like you just learn from your experience, like anything else. If you took like basketball, I like basketball, right? So back in the days, there was a guy that took free throws and he'd go under his legs, throw it up. Everybody thought he was a fool, but he made shots.
No, it doesn't. It doesn't hurt, you guys. For everyone that's doing it, I'm numb. Clearly. How old do you have to be to get lipo?
18 is the ethical age. If there's reasons why people need it at a younger age, I entertain it. Can't say I always approve it, but I'll entertain if people want liposuction younger.
She said I'm way too calm. I don't know how I'm supposed to be.
That's someone projecting their fear.
You are very calm because I'm numb, guys. You just feel a little vibration, but I mean, it's nothing. I want to see it getting flatter.
Isn't that cool?
Yes.
I wasn't going to say anything.
Yeah, it's getting smaller.
Imagine _LYN say the doctor is doing really good.
Yeah, it's actually a big difference.
Someone want to know why your face is not covered.
Mine?
Yeah,
What do you mean?
I have no idea.
Like a mask or?
I guess I don't know.
So, just so you guys understand, we are not in an operating room in a hospital. And
Right.
This is not considered a sterile environment. It's a clean environment. So the rules are different. One of the cool things is the fact that she's awake. She can turn if we need her to turn, and positioning is a lot easier when the patients are awake. I know most people aren't familiar with surgery. I've done a lot of surgery. I've been in the hospital for many years, and the reason why it's challenging when people are asleep is because when you have to try to move them when they're asleep. It's like dead weight, and no pun intended. I mean, nobody's dead, but the phrase, they're dead weight. They aren't awake, so you have to move them, with other people. So sometimes you'll need, 4 or 5 other people to be able to turn the patient over on the side, and even when you turn them on their side, you may not get them in the exact position that you actually need them. So it's way easier when the patients are awake to do these procedures because I can always reposition to get in the perfect position for me, which allows me to get the best results.
So I want to say, imagine _LYN say that's the doctor do his job. He got this. Yes, he got this. If you're on heart medication, can you still get it?
Yes. So if you have a heart problem, we're going to get medical clearance from your doctor, your heart doctor. Since I don't know, I'm not a cardiologist. I'm not going to approve you. You guys want to see this fat? Just walk right by.
Yes.
So this is the first bottle of fat. You can see all the yellow stuff is pure fat. If you look close, you can actually see some of the fat cells. See them moving in there.
You guys see my fat?
And this is like full of air. I think my splatter.
That's
You guys can see this
bad.
is just pure fat here. And you see at the bottom here, there's a little bit of this red stuff, and that's blood mixed with a little bit of fluid, but it's mostly fluid. And this one, there's a little bit more fluid. You can see at the bottom, fluid shift. And it's kind of like a pinkish color, reddish color, and it's just a mixture. There's a little bit of blood that which dyes everything. So you see these little, looks like little brown spots. This is probably gross to you guys, but these are blood clots. And you can see the little fat cells in there. Pretty interesting.
Oh, that's bad.
What happened if you have a loop monitor or a pacemaker?
What's that?
A loop monitor or a pacemaker?
Thank you.
You know, any of these things that you have complicated like medical questions, like I don't know your situation, so I can't answer specifically, you know, especially here live. I need to know your situation in detail, and in most cases I'm going to defer to your treating physician, just like anyone else would do. So like if we were doing spine surgery or brain surgery or hand surgery for that matter, we're going to get you cleared medically through someone who knows who you are, and they're going to run the proper tests to make sure that you're cleared for any type of procedure. So it's the same protocol. We're not changing anything up here. It's just, if you have any of these issues and we need to get you cleared, then that's what we do. But the goal is to keep everybody as safe as possible. We're not trying to kill anybody here. Nobody's ever died doing liposuction here. So we're going to keep it that way.
How long is the procedure?
That just depends on how long it takes. Anywhere from an hour to 3 hours is typical.
It's not even long. For when I first started this live, I don't know how long I've been online.
Oh, let's see, we got an hour on Instagram, so we'll see when we end.
I know it doesn't hurt because I'm numb. I have medication to take afterwards, guys, for pain and things. Just like any other procedure and things.
So any of you that have been trying to diet, exercise, you've been doing all kinds of crazy stuff, trying to lose weight, you're wearing those waist trainers to try and make it look like you're skinny, or you're wearing Spanx to try and cover things up, or you wear clothes to make you look a certain way, certain skinniness, or whatever the case, or certain colors to trim you out. This is the way to get the fat out of you permanently, and is gone forever. Those problems can be a thing of the past. Now, most people live their whole life trying to cover things up, and you know, so nobody knows what their insecurities are. And in fact, most patients, when they come in here, there's always those people that tell them, you don't need this, you know, just do diet and exercise. And what they don't realize is that that person has been trying diet and exercise and they failed. And they also cover everything up. So most people don't even realize how big a person is or what their problem actually is. They have no idea because those people cover it up. So most people aren't walking around here naked if they're uncomfortable with themselves.
What is that thing you got in your
In his hand?
What is that thing you have in your hand?
The light.
I see it.
I'm sorry, that was a funny one.
Oh my goodness. I do lipo, guys.
One girl said she stalked you guys. She stalked my shape since she was 16. She's like, I'm grown and ready
I don't
now.
have to be put to sleep. I'm so glad I don't have to be put to sleep, guys.
Don't let your fear stop you. This is awesome. If you got fat that you want to get rid of, don't let your fear stop you from getting what you want. It doesn't hurt that bad. It's not that difficult. The recovery is not that bad. Cost, it's doable. It's going to cost you. I'm not going to lie, it's going to cost you. But it's something that if you want it, there's no value to it. You know, the confidence that you get afterwards, you can't really put a value to that.
Do you need a strict diet after?
You know, what you do afterwards is totally up to you. I recommend that you live a healthy lifestyle and continue with the, healthy diet and exercise after the procedure. That's going to get you the best results. It'll maintain the results because if you don't change weight, the results will stay the same indefinitely, forever. But it's definitely, it makes sense to live a healthier lifestyle. It is your choice, though. We do recommend, certain foods, everyone's different, though. I gotta be honest with you. I've done a lot of research on diet and exercise, and there's not one diet or one magic bullet that works for everybody, so you really have to test everything. I'm not a nutritionist, so I'm not going to try and give you some, advice from that standpoint. You got to do your own research. But I've heard, good things about different diets, like the paleo diet. I personally tried juice. I'm drinking fresh juices. I recommend that. That works well for me. I've heard of intermittent fasting. I've heard lots of good things about that. You might want to consider intermittent fasting. I personally cut out carbs as much as I can. Try to reduce as much sugar intake as possible. Try and reduce the amount of processed foods that you're eating. Try and eat as much organic food as possible. That's ideal.
You guys should follow my safe lipo because my arms are tired now. So, are you gonna keep recording?
Yeah. Yeah, let's see what happens when you leave. We'll stay on.
Wait, we're on hers, right?
We're on yours. Let's see if it'll let us stay on. If not, we'll just come back on.
Is there someone else out there that can hold your camera?
Oh, let me see. I don't think so, but
Or we can prop it up, maybe?
If you want.
let's see. All right, we're gonna put this down for a second. Let me see.
If we can prop it up there. Okay.
Thank you, Lord, for the bacon.
Or over there, maybe.
It'll be the same shot that I'm doing.
Okay. But if we're on hers, it's beneficial to be on.
Okay.
So just give her. But yeah, I still have my face. I mean, the basic one.
Let's see. Yeah, I can do this, but I gotta get the baseline one.
I can feel.
Huh?
I can feel the way.
You sure? Yeah, just like let your arms relax. I kind of just,
Yes, I will on my YouTube.
let me see how much time we're at.
A little bit of peace, just a little bit, y'all. Like somebody pinches me. You know how your mama pinches when you pinch it like that? No, I'm gonna say my grandmother, because my grandmother used to do that. That's actually the first time I felt a pinch through all this process.
So you guys can see if as a patient you're worried about pain. First of all, she hasn't. This is the first time she's asked me to put any more numbing medication in here since we started. But when you have discomfort, you just take a little break. Put some more numbing fluid in there. Keep right on going. And you don't have to, people always say like they apologize to me, like we have to take a break, but you see how hard I work? Like I like taking breaks too.
Girl, you're not gonna be crying. I'm numb. Thank you, Class Agnew. It's numb. The only thing I feel is like the vibration from him moving. You don't think I see him moving right there?
The stretch marks have gotten smaller. I think they were less visible before because they were so stretched out.
Yeah.
Now they're just contracting and getting smaller.
Girl, you're not gonna pay us all. Don't say that. I pinned them right there. It's my safe lipo in Vegas.
Somebody is on there regulated.
Yeah, girl. Amanda underscore Lena Garrett. Thank you both for making gals. For everyone who's joining, I'm getting lipo. And yes, I'm awake because I'm numb.
You guys are watching my pinches here. They're getting a lot smaller. You know how much I'm pinching. It's slowly getting smaller and smaller as we're moving along.
How long do you have to wait after lipo?
It's typically about 6 months with pregnancy or C-section. If people have like other surgical procedures in their abdomen, like you may have had like abdominal surgery, or you might have had a hysterectomy, or maybe what else people have? Appendectomy, like you have an appendicitis or something. So those scars on your stomach are not going to stop me from doing what I need to do. In fact, in many cases, I can make the scar look better because the scars are they pucker because of the fat that surrounds the scar. So once we take out the fat, the scars actually look a lot better.
Thank you. No, I'm actually not.
And most people, their belly at the bottom here will fold right at their C-section scar. So it's actually, you got a C-section, right?
I actually lost the baby. They had
So she's got a scar down here, and it looks like the belly folded right at the scar. Which is pretty typical. It just seems to be a weakness in the skin that when you get it, the body just wants to fold right there.
Like y'all do before what you do, you know, I'm just playing. So we're like, what? No, it doesn't. Lovely. It doesn't. I'm numb. Thank you for answering.
Any other questions?
Same ones.
Same question. I feel really good.
Oh, they want to know if you're doing 360.
This is not 360, so we're limited on how the volume that we're able to remove in a particular procedure, as well as the numbing medication. So being larger, we're taking a large volume in this area in the front here, which is going to make everything substantially smaller on the front. Typically with these larger individuals, we'll break it up into a couple of different procedures. So we'll start on the front and get as much as we can off of here, and then we'll move around to the sides and the back for the next procedure.
Sweet baby, yes, I will have stickers.
I'm sorry, the people are funny.
Use a laser.
Yeah. So people that are concerned about loosening to the skin, we use a laser. So on these larger individuals that are worried about when we take the fat out that you're going to have loose skin. Most people are worried about that. That's why they're going to be looking for tummy tuck. So as I said, the skin always retracts fat. Always. Question is just how much. Each individual is a little bit different. So to get the most skin tightening with liposuction, we use a laser. The brand of laser that we use is called Smart Lipo. So you may have heard the term Smart Lipo in the past. The laser is passed underneath the skin, and it heats up the inner surface of the skin, causing a contraction. And it's been shown through studies that it stimulates collagen growth for about 6 months after the procedure. You'll get your maximum benefits about 6 months after. But the collagen is the material in the skin that gives you the thickness and tightness. So as you're healing, you want your skin to keep getting thicker and tighter. And if you see these stretch marks in here, it was damaged skin, so it essentially damaged the collagen.
I turned my volume down before we get back into double echo. Oh no.
Yeah, we're down.
I'm from Texas, so I flew here. He's in Las Vegas.
More of that.
No, I don't feel it, Rare Beauty, because I'm numb.
Man, this has got to be the coolest thing ever, right? To be able to go in an afternoon and get your fat sucked out, and you're laying here talking on your phone, and right, like Sunday afternoon, walking the park.
His thug thing. Tell the doctor I said I see him doing his thug thing. Thug thing.
After this, what are the requirements for treatment? I actually have changed my eating habits, guys. I go every other week without eating meat. I already don't eat pork. I haven't ate pork in about 15 years. And now I don't eat beef because I used to eat ribs a lot and trying to clearly see that most of the fat is from ribeye steak. I used to love steak. So I noticed as I was eating ribs all the time, ribeye steak, the next day I was still kind of sick, so I just stopped eating beef. I don't eat beef anymore, and it's probably been about 4 months, and I don't miss it at all. So this is going to be a new experience for you guys.
I know, that's crazy. You guys can notice the belly button looks totally different. So when you have the fat filling in, it covers the belly button, so the belly button will look more like a slit, you know. And now we take the fat out. Everything's a lot spread out. It's much more normal.
Somebody, Lala, wants that the results are amazing. The magic pans of Trevor are incredible. That's why you guys need to come to MyShapelipo in Vegas. The information is pinned, you guys.
And we do offer free consultations. So any of you that are ready to change your life, call and sign up for a free consultation.
Free. And you guys watch my YouTube videos, you guys help me ball in the budget. So you can definitely come here and get your free consultation.
And then those consultations can be done over the phone for you, those of you that are out of state. So we make it really easy. So the only time you need to catch you come here is to get the fat sucked out. I can't do that over the phone. Right.
That's it.
Didn't work. We don't have fast enough internet for that.
My kids are with my mom in Texas, and my husband is out there in the waiting room.
A Klondike bar.
Sounds good.
How long does this process take? Maybe an hour?
It takes as long as we need to. So if we, I'm not going to stop at a certain time. It's not like we're clocking in, clocking out, but you just keep going until the fat's gone. And so you guys see me pinching here. So I'm actually pretty close here on the lower portion of the belly. You can see there's very little left in there. You know, so when I'm pinching, you know, you can see how it kind of is a little bit fuller there. So I can actually feel the fat cells in there. So I feel them and I go, feel them. Leave no fat behind.
No fat left behind.
Yes. Yes. No.
It's no.
So I got a good question. These people aren't thinking about. Why is it that other larger individuals have to go back for liposuction a second time with these other doctors?
Oh,
Anybody have an answer for me?
let's see.
Any of you gotten liposuction and feel like it's bullshit because you didn't get the results that you wanted?
Oh, we have some laughing. Crickets, really, you guys? Crickets. Crickets.
Crickets, that's it? Nothing? No answers? Okay. That's good though. Okay? You guys didn't get duped by other people doing liposuction. But so, this is what I see. I get lots of patients.
Oh, they said they want me to get a tummy tuck.
Who? Oh yeah.
Yeah, they said they want you to get a tummy tuck.
Thank
Somebody
you
else
for
said,
underscoring
I love you.
Yeah.
Yeah. Okay.
So, I get a lot of patients that go somewhere else first, like, and this is typically, you know, a lot of people in smaller towns go to a doctor that's close to you, even though you don't have very many doctors that do this. There may be one guy in town that does it, and he just doesn't do it very often, so he's not very good. But you go to him anyways because it's convenient for you, and you think that helps. The price is right because the guy's giving it away basically because he's not really good at it, so you got to get people through the door. And so these guys will take out very little fat, and their philosophy is you can always come back and do it again later. That's what the doctors are actually thinking before they do these procedures. And I'll tell you the difference here. My thought process is I'm going to get as much fat out as possible so I never have to do this again in the same area. Never. So when you come here, you're going to pay what you pay, but you should never have to get it done again in that same area. I believe if you do this right, you get enough fat out the first time and you give them good results the first time, they should never have to do it again.
Someone said I thought you had to give you a 30 BMI for lipo.
See, that's the bullshit that other doctors tell you. I'm glad you brought that up. When you go other places, you'll hear everyone's different, everybody does things different. You got to realize that truth is in the eyes of the beholder. You don't have to be any particular BMI. I don't even know what her BMI is. I don't really care. Because I'm sucking fat out. It doesn't matter whether she was 10 pounds heavier, 10 pounds lighter, I still need to suck the fat out. The BMI is not even, we don't even calculate it here at MyShapelipo. So when you go to these other doctors and they charge you more because of your BMI, get up and walk out. And give us a call.
Right.
And stop messing with these people, these local doctors that have no experience. You got to go somewhere where they've done this thousands and thousands of times. You go somewhere where a guy can sit there talking on the phone while sucking out the fat and making amazing results right in front of your eyes. And I'm not even looking at it. I can do this with my eyes closed. Literally. I'm not going to that. I literally can.
I really could just go to sleep, honestly. Like I really should take some sleep.
It's getting smaller.
So as you can see, in most of the area, we're getting down to where we want to be. So I'm just kind of doing fine-tuning along the edges, making sure everything is smooth and even and contoured properly. we want to try and create, natural looking results. So when you get closer to the edges of where we're treating, you need to make sure it blends into the surrounding areas. And that's the skill. That's where, that's the difference between a good surgeon and a bad surgeon. It's not hard to take fat out, but it's hard to make it look good.
How many bags are out now?
So we have one and a
Yeah,
half over here.
We're almost about 500.
Once they try to follow me, and I want to mannequins, and the prices are affordable, and the staff is amazing. Yes, the staff is amazing.
Thank you.
Amazing, guys.
You can see how it's scooped out over here, and there's no fat. So we get into the fuller area. So we're not treating down here, so you can see how thick this is. And then see right along this edge. So right now I'm going to try to we can get a smoother transition.
No one has died. Oh my God.
Thank you, OCI.
Oceana?
I have pain medication on board, guys.
Everybody asks about the pain. Who cares if it hurts? Working out hurts. Not eating the foods that you don't want to, that you want to eat. Not eating them, that hurts to not eat them. Life is about pain. If you want something, you go for it. Despite the pain. Even if this hurts a little bit, even if it hurts a lot, it's totally freaking worth it.
Thank you, Ariel Top.
Okay, that's the repan. It doesn't have the dot in there.
So this is a little trick. Don't share this with my competitors. After taking out quite a bit of fat, especially on larger individuals when the layer is really thick, a lot of times most doctors will take out a top layer and they leave the layer covering the muscle. A lot of times it's because they don't even realize it's there, because when you pinch, you can't feel it. And then if you go deeper, you can feel deeper, you can pull the fat up. So it's just a little trick that I've used, and I realized this about 3 years ago, where even though you get out that top layer, there seems to be fat left underneath, and you can keep pinching below, and you keep testing. So this is where it's cool that the patients are awake. So I can keep going deeper and deeper, and as long as I see fat come out here, and as long as the patient's not complaining, then I'm still in the fat layer. But as soon as they start saying that it hurts, then that means I'm getting a little bit too close to the muscle layer, which means I'm almost done, which is a good sign. So I'll use the patient's discomfort to help me get more fat out. Or their, not discomfort, but their feedback on what they're feeling. In the middle? In the middle there?
Yes, I'm awake, guys. I want to say these doctors, man, this is the man trouble.
So I'm digging down a little bit deeper. I'm testing a little bit, so she might feel a little bit. This is how we get amazing results. You can't tolerate it, you know. So this is the area where people hate the most, right? The bottom of the belly. So I'm trying to be as aggressive as possible, get as much out as we can to give you the best chance for that bottom, that panic to not go over the bottom. We want to retract that.
They say they're not really echo now.
You come back over
Mine's
here.
all the way down, so I don't know. This one, hers is breaking up. It's looking real foggy. I don't know. Is there a time on
It has an hour. I'm not sure where we're at though, because does yours have a counter on there?
No, but yours looks very,
It looks funny over there.
really funny.
It usually only counts down after there's like 2 minutes left.
I think
Yeah.
so. Mine is so clear.
Let me see. Well, I can leave and come back. Let's see.
Yes, you guys, I'm getting lipo at MyShapelipo. And then in Vegas, it's pinned right here.
All right. How is it now?
It still looks like that.
It still looks crazy.
Yeah. I don't know. Yeah, it's still, people say it's still blurry. Thank you. I'm at MyShapelipo in Vegas. And they do free consultations, you guys.
How's it look?
I don't know. Yeah. Someone said because maybe going live on different phones, but it wasn't like that earlier. I don't know why it's doing it.
Yeah. I think mine is. This one is dying too.
And you see what I mean? Like, come on, show you. A little bit, but yeah.
Who? Oh, it's fuzzy, fuzzy. Okay.
Yeah, someone said it's blurry.
Okay. Well, we will say adios.
So,
So, guys, I'll come back live later just to let you guys know how it feels and stuff like that. Say bye, Trevor.
See you guys later.
Bye,
Bye, guys. I love you guys so much.
Recovery room.